Good morning, Dr. Gary here on the road. We are dental practice brokers nationwide. And today's topic is an exceptional dental broker knows how to identify unique characteristics of a dental office to make the sale. So we're going to talk about this today. As you know, we're now in 28 states. We have 10 employees. And we have been doing this dental practice brokers for 13 years. I was a dentist for 25. So we bring something special to the marketplace. In addition to having 10 employees with 2 CPA accountants, we provide a whole team to assist you. Now, we're now available from 8 a.m. till 9 p.m. East Coast time every day except Christmas and Easter. So please feel free to call us, even if you need advice. Or if you want a quick appraisal, we can do that for you also. Now, our phone number is 201-663-0935. And our website is dentalpracticeguide.com or nationwidedentalpracticebroker.com. But check it out. We have a lot of information. We just enhanced our website. It should be easier to navigate. Plus, in there, you should be more mobile friendly. So please check that out. Now, if you are thinking about selling to a DSO, please call us because we are on the pulse of the changing marketplace. DSOs are getting more conservative. So we know how to work with them, make things happen for you. And they will pay our commission often. And if you work with us, I can many times get your legal fees reimbursed upon successful closing based on certain criteria. We've done that a number of times. But give us a call on that and we can help you out and get you moving. So let's talk about some unique characteristics of a dental office that may be overlooked by the average buyer. Just misses it. And you've got to be aware of these things as a broker, how to identify them. But not only identify them, you've got to be able to market and advertise properly so that everyone knows why this practice is unique, why it's something special. Let's give you some examples. We saw one today. Practice grossing about $580,000, somewhere around there. And it was in a professional condo, but it's really a building just split in two. So it was a condo, but it's a self-standing building, very noticeable on the outside. Now, the building was probably worth about $700, somewhere around there, but the practice is only grossing about $580. Generally, to get these things sold, you have to have a practice. You're looking for a building that's worth more than the practice. You get a little better cash flow, but unique characteristic now. This one had about 3 ops, and you could convert it to 1 more, get 4 ops out of it. However, what was special behind it, they had a sublet area behind the condo that they owned, and the sublet was an additional 1,700 square feet. That's a lot of room. So now you take a practice that may not be, would probably be passed over by a DSO, but now it's a different story. That DSO could probably fit 9 chairs in there. Now we have a different story. So you may be able to get a higher dollar amount out, but 9 chairs is a lot of chairs. So you go from a practice that's identified on the surface as a $580,000 practice with 3-4 operatories. Now it's really 9 potential operatories. Very big deal, especially with the cost of building and so forth. It's so expensive now. So this is something we're able to do. Now we'll market and advertise this not as a 3 or 4 operatory. We'll market it as a potential 8 operatory office. Then now when you're talking about 8 operatories, you're talking about a lot more room, or 9 operatories, excuse me. This would be a 9 operatory office or 9 operatory potential. And we'll market and advertise at that. Someone may overlook that as a buyer, just glance over it, thinks it's not for them. You've got to bring it in. Now, another one that we had seemed to have a tremendous amount of extractions and endo. We're talking it could enhance the practice in a very short time period over 20%. They were sending out so much endo, root canal, and so much in extractions. Everything was going out. Plus, they were not doing any advertising at all. So you could have a theoretical 20% increase in the practice within 60 to 90 days. And I had it, one of my doctors did this. So 60 to 90 days, you have a 20% increase. That's a big increase. But that's just with the endo and the specialty work they're sending out. They weren't advertising. You've got to pick up another 10% by advertising. So now we're looking at an office that has a potential 30% increase possibly the first year. So you've got to emphasize this. You've got to look beyond. Now, it doesn't mean because there's potential, you're going to immediately get more money. But it does increase your marketing. It makes it more marketable right away. And therefore the ability to sell. And we could push the envelope a little bit as far as the price goes. We can get a little bit of an increased price. But because I'm a dentist, I could identify certain areas. Now, what if they had this spectacular hygienist? I mean, spectacular. I once worked with one like that could co-diagnose or at least help the doctor identify, bring the doctor in, and the hygienist could say, notice certain areas here, bring the doctor in for a co-diagnosis. But she had the ability to at least identify areas of concern, bring the doctor in, dentist, to make the final diagnosis, but she knew how to communicate to the patient. This was an exceptional hygienist. Let's just say that this practice has this hygienist, but they don't have enough hours for him or her. And consequently, they're underserved. If they had the people in there, you have this hygienist that could do an incredible amount of conversion. I once had a hygienist like that the doctor told me they bought the practice from, or no, she needed a recommendation. He told me this hygienist is going to be one of the best in the industry, one of the best hygienists I've ever worked with. And he emphasized that, ever. He said, but she moved out of the area and then fortunately come work for me, which of course would be a fantastic work environment working for me, as you can imagine. Just joking around with you. So, again, unique characteristics. At least sometimes it's potential, but other times it's right there under your feet, and you can immediately turn the practice around. So these hidden bonuses about practices have to be promoted, advertised, and let the buyer know. Okay? And you may be bypassing a great buyer because you didn't advertise it properly. So your write-up of the office has to be an extraordinary write-up. As a broker, we spend time to do that, and we also show the offices many times, but we've got to identify it. I once had this doctor not too long ago, which had a huge sign. I mean, it's one of the biggest dental signs on a building I've ever seen. It was a banner that was so wide and so long, you couldn't miss it from both sides of the highway. That's how big it was. And I think because of that, and they had the rights to use a sign that big, I think the practice would grow. But he wasn't there enough, this one doctor. He was sort of going on disability and couldn't take all the calls. Now, we've had others, believe it or not, that have been refusing new patients because they're tired, they don't want to work as hard. Could you imagine refusing new patients? Unbelievable. Now, this doctor, what he did was he tracked how many new patients that he told, I'm unable to handle you at this time. He tracked them. So when I went in there, we had the data showing, and I think that's important for a dentist. You show that dentist the data with the number of patients that did call and doctors said, I can't take you on, too busy, or I don't want to take on any more new patients. I'm accepting new patients. Now, if you have the data to prove to it, once again, being that we have a marketing manager on our team, one of our employees working about 15 hours a week or whatever, we're able to create our ads, and that will just emphasize this, that they haven't accepted a new patient in 3 years, okay? And the patients continue to call because there's a shortage of dentists in this area. And we could show the data. You've got to do that. You've got to promote that. You've got to know how to promote the practices. Once again, we have the marketing expert on location. So that's what makes us a bit different as other brokers. Besides, we're passionate about what we're going to do. What we do, I'm never going to retire. We're in there for the long haul. See you at the top. Anyway, we have some new information coming in from... we're starting to do some lecturing now. If you want us to lecture to your study group, let us know. We'd be happy to. We just did a lecture, and there's about 30 doctors there, and 4 of them want to sell their practice after they heard us. So I believe we put on a pretty good presentation. I go in there with my accountant, one of the CPAs, and I speak, 30 minutes, whatever, and then we take questions. And, we've been doing this so long, we have an immediate answer to questions. So it must be something in our presentation that wins people over. I may put that on the website. I'll do a video of that. So stay in touch with us. Watch these new YouTubes. Maybe one of them will have a online video of a lecture, and you could listen. And let's see if we could get you as clients. We'd love to have you. Remember, we answer the phone every day except Christmas and Easter, and we're here to make it happen. Buyer or seller, please call us. Great talking to you guys. Got another beautiful day in Jersey. It's cold, it's wet, and it's gray skies. All right, but it will get sunny soon. And there's nothing like the Jersey Shore for 3 months in the summertime. Watch out. I'll see you guys. Bye.